Are you feeling left out that you are not taking or talking about HRT and wondering what you should be doing? Hi, I'm your local OBGYN. I love women, and let's talk about this one. So, hormone replacement therapy is hot. It is what women want to talk about, want to think about, want to consider, and who's right for it and who's wrong for it, and are you doing something wrong by not being on it? And the reality is that it's a very personal thing, and it kind of has a lot of variables that move into it. Number one, is there an absolute no why you should not be taking hormone replacement therapy? And a handful of these things usually revolve around certain types of cancer diagnoses that are fed by hormones. Also, certain blood clot conditions or history of blood clots would rule somebody out. After that, the things that we really need to consider are, what are your symptoms? Are we just doing this because, or is there something that we're treating? Most of the time, the classic way that we OBGYNs are taught to handle this is we treat symptoms, and that can be hot flashes, vaginal dryness, night flushes, all your typical menopausal stuff, except for the fact that we kind of suck at defining what is menopausal and perimenopausal symptoms. So some people have a variety of other symptoms that are not classically put into that bucket, and you could consider hormone replacement therapy for what we currently have as some of the benefits for preventative disease, which is bone density and mental fog and fatigue and worrying about cardiovascular and dementia risks, but that's not a classical reason for prescribing it, though it is something that is worth having a discussion about. There are obviously non-hormonal options to consider, and all of this really has to be tailored to you.